I'm a GP. I've been in practice for 25 years in a rural dispensing practice in West Dorset. I've been practicing homeopathy for almost 20 years during that time. I use homeopathy in my general practice in more or less the same way as I'd use my conventional medicine. I make a diagnosis, I do any investigations that I think might be relevant, and then I decide on a medicine. Instead of conventional medicine, I'd use a homeopathic medicine. I see it as like having another box of drugs. I've got my conventional drugs, I've got my complementary, my homeopathic drugs. I also use homeopathy in general practice in situations where conventional medicine has failed. For example, where a patient with recurrent sinusitis keeps coming back for another antibiotic. Homeopathy has an answer for that sort of situation. I use homeopathy in general practice where, quite frankly, there aren't the conventional medicines for conditions such as leg cramps or glandular fever or molluscum. These are conditions which conventional medicine doesn't have any specific treatment for. The benefits or rewards that homeopathy can bring are varied and many. The greatest benefit, I believe, is the ability to make someone better, to bring about a cure, to ease distress. And so I think that is certainly very rewarding, especially when conventional medicine has not helped. Homeopathic medicine is very cheap. Let's face it, you can't say that about conventional medicine. I like to think that providing a homeopathic service within my NHS general practice, I'm saving money, I'm reducing my drug spend, and potentially I'm also reducing the referrals that I make to a local hospital. Again, that's an expensive process. I think that homeopathy for me has made me a better doctor. It's enabled me to connect with my patients more effectively. It has enhanced my consultation skills. Even my heart-sink patients are less daunting, less to me of heart sinks. So I think that is very, very rewarding. I think that the holistic approach, the whole person approach, just makes so much sense. I have to have a sort of a patient-centered approach rather than a disease-centered approach. I think that is the heart of homeopathy, and I think that is what makes it so rewarding.